Hi everyone, my name is Nidayi Sarkaç. Today I want to explain about single tooth implant surgery and prosthetic part. First of all, if you have a single tooth with a problem, for instance, if you have a cracked tooth, if you have an infected tooth, or if you have a very old crown that decay inside or bad smell or something like that, that has to be extracted. So what can you do about this situation? First of all, in our clinic, we are using one-day implant method. So what's that? We extract your tooth and put directly the implant into the socket and finish in a one surgery, the extraction and the implant part. We finish everything in one day. 1 hour or 2 hours later, we put a gingiva former to your socket. It's all about the protection of your bone. It stops the bleeding and you leave the clinic without bleeding and without pain. So for the prosthetic part, we wait for 6 weeks, the healing period. After 6 weeks, you come to our clinic and we made a digital impression of your gum, of your implant position, and we produce a zirconia crown with a good fit to your implant. So what is advantages of the single tooth implants comparing to bridges? First things, in the bridges, we have to prepare your healthy tooth. This makes some problems because if you prepare your tooth, there can be some sensitivity in the future, or in the 5 or 10 years later, it can be some infection or gingiva infections or decays inside your bridge. But with the single tooth implant method, we protect your healthy tooth. We don't touch your healthy tooth, and in the single tooth implants, it can be long lasting more than 25 years. So these are the most important advantages implant over the bridges. And also in the bridges, after the bacteria invasion starts, there can be some bad smell, there can be some infection corresponding to bad smell or bacteria, and it can be fall down and you can see the bacteria colonization inside the bridge. I can offer you very strongly the single tooth implants over bridges because of that reason. Also, we can prepare a temporary tooth on implants in the same day with your surgery. For instance, if you have a cracked teeth in the front side, when you smile, it can be visible. So we extract your tooth, put the implant, and then the same day, 1 or 2 hours later, we will put the temporary crown to your jaw. So you can leave the office with your temporary crown. Also, you have to be careful about this temporary crown. You don't have to chew. It's only for the appearance from the outside. So when you smile, you can have a full mouth teeth. When you come to our clinic, first of all, we take your x-rays, we scan your mouth, and we see the initial situation about your problem, about your root, about your bone. We manage your implant surgery, all about your bone health. If you have a healthy bone, we can directly start at the same day that you come to our office to your surgery. If you don't have any infection, if you don't have any systematic problems about diabetes or hypertension, we can directly start your implant surgery in the same day that you come to our clinic. After that, we plan your prosthetic parts. 1 month later, nearly 6 weeks later, you have to come second time to our clinic for the prosthetic part. Also, 3D scanning and digital technologies can make everything very easy because with the digital implant technique, we can screw the implant into your bone without any blood, without any pain, and it can be like 2 or 3 minutes operation time. So you can go and start directly to your life at the same day or next day, so you can enjoy everything. And as a result, please don't afraid about single tooth implants because there are a lot of advantages on over the bridge technique. In the single tooth implants, there will be no pain mostly, there will be no blood mostly. It will be more easy than your endodontic treatment or bridge treatment, and we are choosing implant, single tooth implant method nearly every day, and our patients are very happy about this. Thank you for watching me. Please subscribe and like my video. See you then.